Why do HPV abnormal cell changes keep coming back? Imagine a virus hiding quietly in your body, sometimes lying dormant and other times causing trouble. That's exactly what human papillomavirus, or HPV, can do. When HPV infects cervical cells, it can cause abnormal changes that show up on Pap tests. These changes are called cervical dysplasia or squamous intraepithelial lesions. Sometimes, these abnormal cells go away on their own, but other times they keep coming back. So why does that happen? The main reason is that HPV can stay in your body in a low-level or hidden form, even after treatment or when tests suggest the virus is gone. This is called latency. The virus can reactivate later, especially if your immune system isn't strong enough to keep it in check. When it reactivates, it can cause abnormal cells to reappear, which is why follow-up tests might show new or recurring changes. Persistent infection with high-risk HPV types, especially HPV 16 and HPV 18, is a big factor. These types are more likely to cause lasting changes and increase the chance of recurrence. Sometimes, the immune system just doesn't clear the virus completely. Everyone's immune response is different, so some people may clear the infection faster, while others may have it linger longer or become latent. Another reason is that HPV DNA levels can fluctuate. During testing, the virus might be present at levels too low to detect, giving the false impression that it's gone. Later, the virus can be reactivated or detected again, either from reemerging latent infection or a new infection from a new partner or exposure. It's also important to consider that new HPV infections can cause abnormal cells. If someone acquires a new sexual partner, they might get infected with a different HPV type, leading to new abnormal cell changes. Other factors like smoking, co-infections with other sexually transmitted infections, hormonal changes, and contraceptive use can influence whether HPV persists or recurs. In clinical practice, doctors often monitor abnormal cervical cells with follow-up Pap tests and HPV testing. Low-grade changes, especially in young women, often resolve without treatment. But high-grade abnormalities might need procedures to remove abnormal tissue, like a loop electrosurgical excision procedure or cone biopsy, to prevent progression to cervical cancer. Even after treatment, HPV can remain in nearby cells, which is why regular screening is so important. Vaccination against HPV can significantly reduce the risk of infection with the most dangerous types, but it doesn't treat existing infections. That's why ongoing screening is essential, even if you've been vaccinated. In summary, HPV abnormal cell changes tend to keep coming back because the virus can hide in your body, reactivate later, or cause new infections. Your immune response, lifestyle factors, and new exposures all play a role. The key to managing this is regular screening and follow-up with your healthcare provider. Always remember, each person's experience is different, so personalized medical advice is your best guide.